I think a big question for people that might have an acoustic neuroma is being told, okay, let's monitor, wait and see versus when to go in and do surgery. And the stakes are complicated and high because it's like if you in my case, I feel like, "Oh my gosh, I wish I would have found it earlier. Maybe I could have saved my hearing," but once it damages the nerve, it's done.
Right.
So, how do you guide somebody on wait and see and operate, and what do you tell your patients of the deciding factor?
Well, there's several factors involved. One is, of course, the age of the patient. As I mentioned earlier, the younger the patient is, the faster they grow. So you got an older patient who's in their 60s or 70s or 80s. They tend not to grow very fast, and we certainly are not in a big hurry to operate on someone who's 85 years old, even though that's not that
Mhm.
old these days, but it is older. So the three options are: one is observation, two is surgery, and the third is stereotactic radiation, where we can now shine a beam right onto just the tumor and try not to have spread to other structures. And that has a chance of not removing the tumor, but hopefully preventing it from growing. So the observation patients need to have MRIs on a regular basis. We usually start at 6 months. If there's no growth, maybe stretch it out to a year. Also monitor their hearing to see if their hearing's getting worse. Maybe you want to step in earlier and then follow them. And if we see significant growth, it's time to make plan B, which is either radiation or removal of the tumor. Radiation does not eliminate the need for serial MRIs because we haven't removed the tumor. It's still there. We're just hoping it won't grow.